When you're taking your bird to your veterinarian, unless you have an emergency situation, call and schedule your bird for the first appointment of the day in order to avoid potential contact with viral diseases from previous veterinary clients. 1. Make sure your avian veterinarian will allow you to be present in the exam room with your bird for all procedures. Note that birds taken into back rooms without owners can die of stress. This has happened. 2. In preparation for the trip to the vet clinic, plan to place your bird in the travel kennel only at the last minute in order to reduce the time spent in the kennel, which may cause stress to the bird. 3. Please note the band number and name of your bird for the vet records. Take along any important documents, such as weight charts and photos of questionable feces. 4. If you have questions, write them down before you go and take along a notepad to write down the answers to your questions and to write down veterinary comments about your bird. 5. Once in the exam room, ask your immediate questions before the vet touches the bird, so that the time handling the bird is not interrupted or extended by your questions. 6. When the vet is examining or handling the bird, do not talk to the vet, as that distracts and lengthens the handling time, which increases the bird's stress. 7. If the vet is doing something that seems extremely contrary to the health of the bird, ask the vet to stop and to explain the procedure. This is your bird. 8. After the exam and procedures are completed, ask any other questions. Request a report of the bird's test results and condition to be emailed to you for your files. Do keep these files on your bird. 9. Never let an avian vet give an Eclectus parrot a vitamin shot. Eclectus have died from vitamin shots administered by vets. Man-made vitamin A is a serious problem for these parrots. 10. Do not have your Eclectus parrot's wing clipped unless it is critical for the bird's health. Wing clipping very often leads to feather chewing as the bird attempts to fix the cut feathers. 11. If you have a new bird, basic information about the bird's health can be obtained by the CBC blood test and report. This blood test should be done early in the exam process. 12. When you have a sick bird, it is critical the following tests are done: CBC blood test, swab of throat, separate swab of the cloaca, and cultures grown in a lab from those two swabs. 13. Results of lab cultures will indicate bacterial growth, and the appropriate medications will be determined from that information. It is not advisable to medicate a bird before swabs are taken. 14. With a bird acquired from an unknown or questionable source, it is important to quarantine the bird for 30 days and to have a veterinarian test the bird for PBFD and psittacosis. 15. If a bird dies, it is important that a necropsy be performed to determine the cause of death. 16. Place a dead bird wrapped in paper towel into an open plastic bag into the refrigerator and not into the freezer. The open bag allows the body to cool and the tissues to be preserved. 17. Take the dead bird to the vet for a necropsy as soon as possible after the death so that tissues do not decay and prevent the analysis of the cause of death. 18. Ask the vet to collect tissues for histopathology if the cause of death is not apparent. The vet will know where to send tissues and how to prepare tissues for histopathology. 19. Request a full report on the necropsy and the histopathology be sent via email or mail to you for your files, and ask if the problem is a communicable disease. 20. If the problem is a communicable disease and you have other birds, ask the veterinarian what you should do to protect those birds from the disease and follow the recommended procedures carefully. I felt it was important to provide this information to the many pet owners out there who may not have a complete idea of how to approach taking their bird to the vet, because there are many different consequences based on what is done. For instance, stress. It is really critical that the pet owners stay with the bird during all procedures, because when the bird is separated from the owner, the bird is terribly frightened, and birds are genetically programmed to have stress, and when that stress reaches a certain level, the bird is programmed to die. This has happened too often to healthy pet birds that have been taken into a back room by a vet. So please never let that happen. The reason for making these comments is that over the last 40 some years of working with birds, I have received questions from many different bird owners about all sorts of things concerning their bird. And it seems that these 20 points are basic in terms of dealing with your veterinarian. And most veterinarians are very willing to be of assistance to the bird owner and to keep the bird healthy. So when you are dealing with a bird that has questionable health, it is very important to review these procedures and take action. Good luck with your birds. We at Eclectus we love our birds. We have primarily Eclectus, but we do have some other species, and I have worked with many other species. So we urge you to do your best for your birds and enjoy them. Thank you very much.